Hi, in this lesson we will look at risk communication after the product enters the market as an integral part of the risk management process. Risk communication is a structured, ongoing, two-way process to exchange and share information between interested parties on risks that may arise due to the interaction of consumers with child products during their whole life cycle. Some of the interested parties are producers and distributors, government and authorities, professional organizations like consumers and health agencies, and users of the product, not only children, but also the parents and other carers that interact with the product. So which are the obligations of suppliers? The General Product Safety Directive, we'll see it in detail in the next session, defines that only safe products can be placed on the market. To ensure safety during the whole life cycle of the product, suppliers, including producers, importers, distributors, have the obligation to provide consumers with all relevant information for safe use without unacceptable risks, to monitor the safety of products on the market, to be aware of any risks that may arise during use, and inform consumers or the competent authorities if they discover that a product they have placed on the market is unsafe, and to keep and provide necessary documentation for traceability so that they can cooperate with the competent authorities if a serious risk emerges. There are several tools available for risk communication. Considering the two-way process, there are tools to obtain information from the user's interaction with the product, so get to the sources of information, and to use and disseminate information about risks to consumers, the competent authorities, or other interested parties. Producers, authorities, researchers, or other interested parties can use different tools to collect information on the behavior of products during use. To fulfill the obligation of monitoring the safety of products, suppliers can establish a system to encourage and manage complaints, incident reports, or doubts from consumers as part of customer care. Consumer complaints or reports are a valuable source of information. The analysis of data received can help identify new risks and improve the safety of your product in the short term by changing the design, providing further instructions for safer use, or other actions. Other sources of information on emerging risks can be found in accident and injury data from hospital admissions, accident reports by the media, recalls of similar products, research and studies. The information can be used as input for the risk management process, induce new risk assessments, and confirm or lead to new decisions on risk acceptance and risk treatment needs, including risk communication. For instance, ANEC uses injury data, accident reports from national consumer organizations, or results from research studies as input to upgrade safety standards on children products with a hazard-based approach, or to lobby for policy changes at European level. As a tool to communicate serious risks, we have RAPEX, a rapid information exchange system between member states, established under the General Product Safety Directive and managed by the European Commission. It allows for a quick exchange of information on dangerous products and measures such as recalls of products posing a serious risk to safety, whether carried out by national authorities or by voluntary action of producers and distributors. Information on dangerous products is available to the public on the RAPEX website. Other tools for use and dissemination of information to interested parties on risks and actions to reduce them are health and consumer organization networks, publications, websites, or education campaigns, the media that issue press releases or public information, and the professional training, in particular with a multiplier effect, like for health and education professionals, dealing with parents in nurseries, kindergartens, hospitals, or home visiting, playground operators, inspectors and maintenance people, or even staff of consumer organizations. To communicate risk efficiently, the information provided should be clear, strategic, and solution-oriented, in order to empower people and give them information to act and for free choice without creating panic, excessive concern, or a feeling of powerlessness. The message should use clear language considering the target audience, parents, professionals, technical committees. It should be factual, objective, and specific about the risk, Avoid general statements like "it's dangerous." Be clear about actions to be taken, like take the pushchair to the shop and they will give you a replacement harness. And it should encourage behavior change, like with awareness campaigns on specific products with practical tips. As a summary, there are some key issues about risk communication during use to remember. Risk communication is an integral part of risk management process and is crucial to monitor the safety and control the level of risk in new products for children as soon as they enter the market. Aftermarket risk communication is a two-way process to obtain, exchange and share information between interested parties, like consumers, suppliers, authorities, on risks that may arise due to the interaction of consumers with the products. The General Product Safety Directive sets obligations for suppliers concerning risk communication to consumers and the possibility to act if a serious risk arises. There are different tools available for risk communication. To get information about risks, injury data, RAPEX system, consumer complaints, or to use and disseminate this information, again using RAPEX system education campaigns on the media. And finally, the message to communicate the risk should be strategic and solution-oriented in order to empower the target audience for action towards a safer product or a safer use. Thank you.